Hello and welcome to my YouTube channel AnatomyMentor. Today I'll be discussing the development of the nervous system. This is the second lecture in the series of lectures which focuses on the embryology of the nervous system. Last time we discussed in detail the formation of the spinal cord, and today's discussion will be focused on the development of the brainstem, which includes the medulla, the pons, and the midbrain. In addition to that, we'll also discuss the formation of the cerebellum. And in the end, I will be talking about the neural tube defects, that is spina bifida, and the different types of spina bifida. So these are our learning objectives for today. So discussion will focus on a bit of a recap on the different aspects of spinal cord development that we talked about last time. Well, here you've got these two cross sections which are through the spinal cord, and they're showing the developmental stages of the spinal cord. So on the left, you can see the earlier stages, and over here, you can see that the cavity in the center is a large cavity lined by the neuroepithelial cells, which I mentioned previously are the mother cells, which give rise to the neurons and the neuroglial cells of the central nervous system. Now, outer to the neuroepithelial layer is this here mantle layer, which consists of the neurons, and the mantle layer itself is further divided in the initial stages into the alar plates and the basal plates. Now, the alar plates are the regions in blue. They are dorsal in their location, and they represent the sensory areas. And here you've got the basal plates, which are the areas in red, and they are ventral in position, and they represent the area of formation of the motor neurons. Also, you can see the roof and floor plate are the sites where neurons are not present, but the nerve fibers are located over here. Outer to the mantle layer is this here marginal layer. Marginal layer does not contain neurons. Instead, it contains the nerve fibers of the neurons. Now, let's focus on this diagram B, which is showing us the later stages of spinal cord development. We had discussed previously, as this is a recap of the previous lecture, that the mantle layer is going to form our gray matter, the gray matter of the spinal cord, whereas the marginal layer is going to form our white matter of the spinal cord in the later stages of development. Here you can see that the gray matter of spinal cord consists of the posterior or dorsal sensory horns and the anterior or ventral motor horns. These are derived from the alar and basal plates respectively. Also, the dorsal horn you can see is narrow, whereas the ventral horn is broad. The further change that has occurred is the constriction of the central canal into a narrow cavity, and you can see over here is the dorsal median septum, and anteriorly you've got the ventral fissure. So this was the development of the spinal cord, which we discussed last time. We are focusing on the alar and basal plates. Similar alar and basal plates are also present in the region of the neural tube, which is going to give rise to the brainstem. So whenever we talk about the formation of the brainstem, we can make it easier to understand if we focus on the alar and basal plates, what is going to happen to the alar and basal plates in the region of the brainstem. So first, we are going to discuss the development of myelencephalon. Now, if you recall from the previous discussion, there are 5 secondary brain vesicles in a craniocaudal sequence. These are the telencephalon, the diencephalon, mesencephalon, meton, and myelencephalon. So the caudal most is myelencephalon, meaning this is the secondary brain vesicle which is going to form our medulla oblongata. And it is the pontine flexure which is present between the meton and myelencephalon, because both these secondary brain vesicles, meton and myelencephalon, they are derived from the primary brain vesicle, which is the hindbrain, also known as the rhombencephalon. So the pontine flexure subdivides rhombencephalon into meton and myelencephalon, and as I mentioned, the myelencephalon is going to form our medulla oblongata. So here is a sagittal view of the developing upper part of the neural tube, where you can see these here are the brain vesicles, and now the 5 brain vesicles are the telencephalon most cranially, which is going to form the cerebral hemispheres. Then comes the diencephalon, which is going to form the hypothalamus and the thalami. And then we've got this mesencephalon, which is going to become our midbrain. And then comes the area which is the rhombencephalon, the hindbrain area, which is now subdivided into this here metencephalon and myelencephalon by the presence of the pontine flexure. Now, this myelencephalon is the caudalmost secondary brain vesicle, or you could say the caudalmost part of the developing brain, and this is going to form our medulla oblongata. Now, keep in mind that the lower part, that is the caudal part of the medulla oblongata, it resembles the spinal cord, and this is the closed part of the medulla oblongata. Whereas the upper or cranial part of the medulla oblongata, this is wide and flat because the lateral walls, they become everted. Everted means they become opened up like so, the pages of an open book. So this would be the appearance of the upper part of the medulla oblongata, which is its open part. Now, because the lower part of medulla oblongata is similar to the spinal cord, the position of the alar and basal plates is similar as it was in the spinal cord. But the upper part of the medulla oblongata, since it has become opened up, so it means it has become everted, that causes a repositioning of the alar and basal plates. In this case, the alar plates, they will come to lie lateral to the basal plates. So I'm going to show this over here in the schematic drawings, which are showing us the development of the medulla oblongata. And you can see over here in diagram A, this is the initial stage in which we have the primary brain vesicles. And then you can see in the next diagram, this is a cross section through the area which is known as this here myelencephalon, the area which is going to form the medulla oblongata. Now, this cross section is showing us that posteriorly, which was the region of the alar plates, this region has formed the gracile and cuneate nuclei, and anteriorly, the region of the basal plates has formed the pyramids. But this is a section through the lower half of the spinal cord. Therefore, it is resembling the, this is through the lower half of the medulla oblongata. So it is resembling the spinal cord in that the alar plates are present posteriorly and the basal plates are present anteriorly. Also, the central canal is a narrow canal. It's a narrow passageway, and this is the closed part of the medulla oblongata. Now, let's look at a section which is drawing C. It is representing the section through the upper part of the medulla oblongata. Over here, you can see now this is known as the open part of medulla oblongata. So you can see that the central canal is now the fourth ventricle actually, and this has the central canal has been replaced by fourth ventricle. And this you can see is a broader cavity. And over here, let's look at the repositioning of the alar and basal plates. These are the basal plates which are now present medially, and now the alar plates, you can see they have shifted laterally. So the medulla oblongata, you can say, has become opened up as if you would open the pages of a book, and because of that, the alar plates have now come to lie lateral to the basal plates. The roof plate is over here, and this is the sulcus limitans, which is present between the alar and basal plates. So in the further stages of development, as you know, the alar plates are going to form the different sensory nuclei, the afferents, and the basal plates are going to form the different motor nuclei, that is the efferents. So here you can see the efferents are present medially and the afferents are present laterally. This is the section through the upper half of the medulla oblongata. Keep in mind that there are 4 functional components of each spinal nerve. Namely, you can see over here that is the somatic sensory, the visceral sensory, then you've got the somatic motor and the visceral motor. So these are the 4 functional components. You can write them down. They're the 4 functional components of every spinal nerve. Now let's look at over here the cranial nerve, and if we compare to the spinal nerve, each cranial nerve has 7 functional components. Okay, so now these 7 functional components have been summarized over here in a table, and they are general somatic afferent, special somatic afferent, general visceral, and special visceral afferent. These are the 4 afferents, and they're abbreviated as capital letters. And then you've got the 3 efferents, which are general somatic efferent, visceral efferent, and then the special visceral efferent. Now, these are the 7 components of the cranial nerves. So if you look at the general somatic afferent, you can see over here that they convey the general sensations, whereas special somatic afferent are the sensations of hearing, balance, and vision. Those sensations which are coming from the viscera are the general visceral afferent, whereas special visceral afferent would be smell and taste. General somatic efferent are those which are going to the striated muscles, whereas the efferent fibers which are going to glands and smooth muscles are the visceral efferent. And special visceral efferent are the nerve fibers which are going to those muscles which are derived from the brachial arches. So this is the summary of the functional components of the cranial nerves. Now we talk about the development of metencephalon. Metencephalon is a part of the rhombencephalon or hindbrain that is going to form the pons and the cerebellum. So the pons, you know, is a pathway of nerve fibers between the spinal cord and the cerebral and cerebellar cortices, whereas the cerebellum is the part of our brain which is the coordination center for posture and movement. Now, first we're going to discuss the development of the pons. The pons, you know, the marginal layer of the basal plates of the pons expands, forming a bridge for nerve fibers. That's the marginal layer. You know, the marginal layer is the one which contains the nerve fibers. So it forms the bridge for nerve fibers. That is the bridge of the pons. And motor and sensory nuclei, they are going to be present in the floor of the fourth ventricle because of, then again, the divergence of the lateral walls of the pons. And pontine nuclei, remember, they originate in the alar plates. So here we've got a cross section through the pons, and we can see over here, this is the upper part now of the fourth ventricle, and it is covered over here by the roof plate. And in the floor of this fourth ventricle, we have the nuclei. The motor nuclei are present medially. They're derived from the basal plates, and sensory nuclei, which are color-coded as blue, they are present lateral to the motor nuclei, which are red. And you can see over here, this is the arrangement, which is in continuation with the upper part of medulla oblongata. Also, the pontine nuclei, as I told you, they are derived from alar plates. Now, if we come to the cerebellum, this is the structure which is also derived from the metencephalon. In this case, what happens is that in the region that is going to become the cerebellum, the dorsolateral parts of the alar plates, they bend medially and they form the rhombic lips. So structures known as rhombic lips are formed and they're derived from alar plates. Further deepening of the pontine flexure causes the rhombic lips to become compressed cephalocaudally and form the cerebellar plate. The cerebellar plate then differentiates into a small midline vermis and two lateral hemispheres. So in the formation of the cerebellum, you've got to remember the structures which are the rhombic lips, which fuse and then they form a structure which is known as the cerebellar plate. Here we can see the posterior view of the developing brainstem, and over here you can see that these are the rhombic lips. And if you look over here in the floor, you can see of the fourth ventricle, the basal plates which are present medially, and lateral to the basal plates are these alar plates which are present laterally. And now these rhombic lips, as I told you, they are derived from the alar plates. They are going to fuse cephalocaudally, which means in the craniocaudal sequence, in the craniocaudal direction, and they will form this structure now, which is known as the cerebellar plate. This cerebellar plate is now going to further differentiate into the cerebellum, in which case the midline portion remains narrow. It is known as vermis, and the lateral parts of the cerebellar plate you can see are expanded to form the cerebellar hemispheres. If we look at the sagittal section, you can see this here is the developing pons, and this is medulla, and here over this region over here of the rhombencephalon is the one which is forming our cerebellum. And this is a cross section. If taken at this level, you can see the cross section which is showing us the nuclei in the floor of the fourth ventricle. And keep in mind the efferent or motor nuclei are present medially, whereas the afferent or sensory nuclei are present laterally. And over here, you can see the further in the development in the sagittal sections. This cerebellum is now going to form the lobes, which are anterior lobe, and then posterior lobe, and this here, then the development of the folia, and this is the development of the cerebellum. The cerebellar cortex is the layer of gray matter which is present on the surface of the cerebellum. When we talk about the development of the cerebellar cortex, remember initially during intrauterine life, we have the pattern which is similar to the pattern which we saw as in the spinal cord. We've got the neuroepithelial layer internally surrounded by the mantle layer and then the marginal layer. Now, what happens is that in the initial stages in intrauterine life, on the surface of the cerebellum are present the tiny granule cells forming the external granular layer. So they're present on the surface of the cerebellum, but later on these granular cells are going to move inwards and form an internal granular layer. Also, you can see the Purkinje cells. These are the large flask-shaped cells which are present in a single line adjacent to the granule cell layer. And deeper within the cerebellum is the white matter, which then contains the dentate nucleus. Here is a magnified drawing which is showing us the cerebellar cortex development. So like I said, in the earlier stages, the external granular layer is present on the outer surface of the cerebellum. And you can see over here next to it is a single file of the flask-shaped Purkinje cells. Now these arrows are showing the direction of movement of the granule cells inwards. So eventually, that is postnatally, if you look at the cerebellar cortex, the granule cell layer has now become the internal granular layer, and outer to that are the Purkinje cells, and the outermost layer is the molecular layer in the cerebellar cortex. Now let's talk about the mesencephalon, which is the secondary brain vesicle that is going to form our midbrain. The marginal layer of each basal plate enlarges and forms crus cerebri. So like I told you, whenever we talk about development of any region, we are going to be explaining it in reference to what happens to the alar and the basal plates. So in the region of the mesencephalon, the basal plates are forming the crus cerebri, whereas the alar plates, they are representing the sensory areas. So they're going to form the superior and inferior colliculi, which are present on the posterior aspect of the midbrain. So here we've got the section of the midbrain. This is the level of the mesencephalon. This is the area of the mesencephalon. We've taken a section over here. We're looking at the cross section, and we can see over here in the further stages of development that posteriorly is the inferior colliculi at the lower level, and at the higher level you've got the superior colliculi. Remember, the colliculi, they are developed from the alar plates of the mesencephalon. So they have the sensory neurons. And we know superior colliculus is the component of the visual pathway. Inferior colliculus, they are components of the auditory pathway. And anteriorly, if you look over here, the section of brainstem, we will see the crus cerebri. They have developed from the basal plates. So this covers the basics of the formation of the brainstem. And now we're going to talk about the clinical aspect, which is the neural tube defects. We have been discussing this before. What is the cause of the neural tube defects? Whenever there's going to be defective neurulation, the defective neural tube formation, then that can cause some gap, deficiency, or opening in the neural tube, and that is known as the neural tube defect. And it has many different types depending upon the severity of the defect or the location of the defect. So we can simply say the embryological basis of NTDs is abnormal closure of the neural folds in the 3rd and 4th weeks of development. Now, what is spina bifida? The name itself is self-explanatory. It shows there's a split in the spine. So spina bifida is the neural tube defect which occurs when there is defective neurulation in the spinal cord. And there are different types of spina bifida. Like I said, it depends on the severity. You can simply say it is a splitting of vertebral arches, and it may or may not involve underlying neural tissue. Here is the sagittal section through the spine. This is the normal spine, so we can compare it with the different types of spina bifida. The spina bifida occulta. Occulta is the type of spina bifida which is not so obvious on the external appearance. So the word occulta, literally means hidden. So on the surface, the skin is covering the defect. This is the defect through the vertebral arches only. It is not involving neural tissue, and the skin surface is intact. There might be just a tuft of hair in this region. This mostly occurs in the lumbosacral region if it would occur, and this is known as the spina bifida occulta. So there might only be a dimple of skin or a tuft of hair in the lumbosacral region to give an indication of the underlying defect. Here is spina bifida with meningocele. In this case, the meningeal layer has extruded or herniated through the defect, and it has formed a cyst-like, you could say, lump on the surface of the body. This is the spina bifida with meningocele. Now, if this cyst contains neural tissue, then it is called spina bifida with myelomeningocele, and obviously this is a more severe form of the congenital defect. Then again, these are the types of spina bifida. Here you can see the baby with the cyst on the lumbosacral region. And as I told you, the cyst, if it contains only the meninges, it is spina bifida with meningocele. If it has neural tissue, it is spina bifida with myelomeningocele. And D, you can see these are the cross sections through the spina bifida, and you can see in the last one, D, the surface the neural tissue is completely exposed on the surface, and this is the most severe form, which is known as myeloschisis or reishi-schisis. And if we compare it with spina bifida occulta, you can see the skin is intact and there's only a tuft of hair over here, and the spinal cord and meninges are in their normal location. The defect is only in the vertebral arches. So A over here is spina bifida occulta. Now, what is the etiology of neural tube defects? It is multifactorial. There are different causes which play a role. Nutritional deficiencies has been identified as an important etiological factor, particularly the deficiency of folic acid, vitamin B12 in the mother can cause neural tube defects in the newborn. Also, there are certain drugs which can act as teratogens, that is valproic acid, which is an anticonvulsant drug, even hypervitaminosis A or certain physical conditions like hyperthermia, they can all contribute to the development of NTDs. How can we diagnose NTD? Well, ultrasound in the 10th or 12th week of intrauterine life would be the diagnostic factor for a neural tube defect in the fetus. Other than that, you can perform the levels of different substances, alpha fetoprotein levels, which can be taken from the maternal serum or from the amniotic fluid. These levels will be elevated in case of NTDs. How can we prevent neural tube defects? Well, because the folic acid deficiency has been identified as an etiological factor. So, of course, the prevention would be that the mother is not deficient in folic acid. So, food needs to be fortified with folic acid. And any woman who is planning to conceive should be given, or she should be taking 400 micrograms per day of folic acid. And if she has a family history of NTD or she has previously had a child with NTD, then this quantity of folic acid would be increased to 4,000 micrograms per day. And if NTD has already developed and it can be corrected surgically during gestation, that is experimental in utero surgery, is also an approach towards correcting NTDs before birth of the baby. So this concludes with today's discussion on the development of the nervous system, in which we talked about the formation of the brainstem. So my approach towards the formation of the brainstem is, if you focus on the alar and basal plates, then you can keep in mind the important developmental points regarding each area of the brainstem, whether it is the medulla, pons, cerebellum, or the midbrain. So you have to understand what is happening to the alar plates and what is happening to the basal plates. Okay, so this concludes with today's discussion, and we're going to be coming back in my third lecture in this series. I'll be talking about the formation of the telencephalon and the diencephalon. So if you found this discussion helpful, don't forget to like and subscribe to my YouTube channel, AnatomyMentor. You can do that easily by just clicking on my picture, which is going to appear at the end of this video presentation. And don't forget to hit the bell icon for notifications of the recent updates of my new lecture topics. Okay, so stay blessed, enjoy your studies, take care.